All right. Okay, so we're almost done. I just have a few more questions. So, are you allergic to anything?
Yeah, penicillin.
Okay. And how about medical conditions, any illnesses?
No.
You sure? You look like you're not.
Well, I mean, I had asthma as a kid, but I outgrew it.
Okay. How about surgeries? Any surgeries?
I had my wisdom teeth taken out in my
Okay.
20s.
And how about family history? What does that look like?
My parents both have high cholesterol, and my dad's grandma had a bunch of heart conditions.
Okay. All right. So, unfortunately, now I have to ask some questions about alcohol and drug use, and we have to ask everyone. So, I apologize, but just bear with me.
Mm-hmm.
So, in the past year, you haven't had any alcohol to drink or any drinks containing alcohol, have you?
I have.
You have. How much, I guess?
How much do I drink?
Mm-hmm.
Um, Usually, like, you know, 2 glasses of wine a night.
Two every night.
Mm-hmm.
Okay. And about how often do you have four or more drinks on one occasion?
Not often, maybe just a couple times a year.
Because it sounds like you're drinking a lot. So you sure it's only been a couple times a year?
Yeah.
Okay. Now it's drug questions. How about marijuana? Do you smoke any marijuana?
I have in the past,
How about in the past year?
maybe just a couple times.
Okay. And then how about prescription medications that weren't yours? Have you taken any mom, dad, borrowed any meds from them? No. Okay.
Yeah,
And how often have you taken your own medication more than that was prescribed, or for a different reason?
I haven't.
Okay. You don't use any other drugs, do you? Like cocaine, heroin, any hardcore drugs, anything like that?
No.
Okay. Do you smoke or use other tobacco?
No.
Okay. And how about in the past couple of weeks, how often have you been bothered by little interest or pleasure in doing things?
I haven't.
Mhm. And how often have you been bothered by feeling down, depressed, or hopeless?
I haven't.
All right. So now I got to ask a few more questions. I'm almost done. What's your gender?
What do you mean?
Like, what are you? What do you consider yourself to be? I have to ask everybody. So,
Well, I'm a woman.
okay. And I just have a few more like that. So bear with me. Are you Hispanic or Latino?
Yes.
And what are you? Hispanic or Latino?
What do you mean? What
Hmm.
am I?
Like, what are? Oh, like, where do you come from?
Oh, my parents are both from Spain.
Okay. And how about the Armed Forces Reserves or the National Guard? Have you ever served?
Yeah,
Which one?
in the Air Force.
And are you on active duty currently?
No.
Ever been to a combat zone?
Yeah, Iraq.
Okay. And my last question, are you taking any medications?
I mean, just vitamins.
What's that?
Just vitamins.
Okay. All right. And that's it. Thank you.
All right, Patty, I see in your chart that you're allergic to penicillin. Are you aware of any other allergies or do you have a history of any allergic reactions?
No, that's it.
Okay. Do you have a history of any medical conditions or illnesses?
I had childhood asthma as a kid, but I outgrew it a long time ago.
Okay. Have you had any surgical procedures?
Just my wisdom teeth extracted.
Okay, and when was that?
I think I was around 21, 22.
Okay. All right. Can you tell me a little bit about your family medical history and any medical conditions, mental health conditions among people in your family?
Yeah, so both of my parents have high cholesterol.
Okay.
My mom has high blood pressure, and my father's mother had a lot of heart conditions. I'm not sure what exactly.
Okay. Thank you.
Mm-hmm.
All right. We also ask all of our patients about behaviors that increase the risk for accidents, injuries, and other conditions that bring people into the ED.
Mm-hmm.
So, first, I'd like to ask you a little bit about your alcohol use.
Mm-hmm.
So, thinking back over the past year, and when I talk about a drink, I'm talking about one 12-ounce beer, a 5-ounce glass of wine, or one mixed drink. with
Mhm.
a single shot, which is 1.5 ounces of liquor.
Mhm.
So in the past year, how often have you had a drink containing alcohol?
Most nights.
Okay.
Yeah, usually nightly.
Okay. And how many drinks containing alcohol do you have on a typical day that you're drinking?
Usually about 2 glasses of wine, usually with dinner.
Okay. How often do you have 4 or more drinks on one occasion?
Not often, maybe like 3, 4 times a year at a social event.
Okay. How often have you used marijuana or cannabis in the past year?
Also not too often, every once in a while at social events, maybe like, 4 or 5 times.
4 or 5 times in the past year?
Mm-hmm.
Okay. All right. How often have you used prescription medications that were not prescribed to you in the past year?
None.
Okay. How often have you taken your own prescription medication more than the way it was prescribed or for different reasons than its intended purpose in the past year?
I haven't.
Okay. And how often have you used other drugs in the past year, such as cocaine, street heroin, speed, or club drugs?
Used ecstasy just a couple of times at parties in the past year.
Okay. In the past month, how often have you used tobacco products, such as smokeless tobacco or e-cigarettes?
Not at all.
Okay. That's great. That is a healthy choice. We know that tobacco is linked to a lot of health problems. All right. Over the past 2 weeks, how often have you been bothered by little interest or pleasure in doing things?
I haven't.
And over the past 2 weeks, how often have you been bothered by feeling down, depressed, or hopeless?
I haven't.
Okay. Okay, great. Sounds like you've been managing your mood pretty well. I just have a few additional background demographic questions for you that we ask of everyone.
Mm-hmm.
First, what is your gender?
That's an interesting question. I'm curious how you all ask that.
Well, for a lot of people, it's the case that they find that to be kind of an odd question, but our policy is not to assume what someone's gender is, and we always
Yeah.
ask and let them reveal how they identify.
Yeah, well, I identify as female.
Okay, thank you. All right, I have a few additional background questions for you.
Mhm.
Are you of Hispanic or Latino descent?
Yes.
Okay. And what ethnic group do you consider yourself?
What do you mean?
For example, would you consider yourself Central American, Cuban, Dominican?
Oh, I see. Spanish American?
All right, and I have a few questions about military service history. Have you ever served in the armed forces, in the reserves, or the National Guard?
Yeah, I served in the Air Force, but no longer. I'm a veteran now.
Okay, so you're not currently on active duty in the armed forces,
No.
reserves, or National Guard.
Mhm.
Okay. Have you ever been deployed to a combat zone?
Yeah, to Iraq.
Okay. All right, I'd like to review any medications you're taking at home.
Mm-hmm.
Are you taking anything?
I'm not.
Okay. Nothing over the counter? No supplements?
Just vitamins.
Vitamins? Okay.
Yeah.
All right. Thank you so much.